As soon as they are born, babies need mother's milk. Any problems in feeding or digesting can quickly lead to low blood glucose levels, which is why hypoglycemia, as this is called, is extremely common in newborn babies. It can cause very severe symptoms such as seizures, irregular breathing, and apnea or reduced consciousness. But symptoms may also be much milder and non-specific, such as irritability and lethargy. And in some babies, there are no symptoms at all. This means the only way to identify hypoglycemia is to measure blood glucose levels. Hypoglycemia is also the most common emergency to occur in neonatal patients. Identifying hypoglycemia is very important as it can lead to permanent brain damage if left untreated. Blood glucose levels are measured in several different ways. The most accurate is to send a sample to the lab. This is recommended as a confirmatory test where available, particularly for more persistent or recurrent cases. But for emergencies, the results will take too long. There are glucose strips that change color according to a visual scale. But these are not recommended as they are much less accurate. Finally, there is the glucometer. Glucometers have the big advantage of giving an immediate result. They are not as accurate as a lab test, but serve as an important tool for emergency treatment. There are many different models on the market. Most are very simple. On this model, there is an on and off switch in the middle, and then 2 buttons to navigate through the menu. Glucometers use test strips. These are often specific to different machines, so you have to use the correct strips. They also need to be in date. You use one of these per reading. One end of the strip is metallic, which goes into the machine to form an electrical connection. Often, you need to put in the strip for the machine to turn on. The glucometer works by touching the test strip onto a drop of blood. The drop is sucked into the strip by capillary action. The glucose in the blood reacts with chemicals in the test strip to produce a tiny electrical signal which goes into the machine via the gold-colored electrical contact. Depending on the strength of this signal, the machine is able to estimate the level of glucose in the blood. Blood glucose levels are expressed either in millimoles per liter or milligrams per deciliter. You can convert between the two by multiplying or dividing by 18. Blood glucose levels in newborn babies should not fall below 2.5 millimoles per liter or 45 milligrams per deciliter. In the following films, we will show you how to use a typical glucometer to check that a baby is not suffering from hypoglycemia.